So hello guys, so now we shall be discussing regarding the branches of your trochlear nerve. Now when it comes to the branches of the trochlear nerve, first of all you have to know that trochlear nerve is your cranial nerve number 4. Okay, so that is what is your trochlear nerve. Now within this trochlear nerve there are few important things you have to know. For example, this colliculus which you can see over here, right? So these colliculi which you can see over here are called as inferior colliculus. This is called as your inferior colliculus. Next, after this inferior colliculus, this nucleus which you can see is called as trochlear nucleus. Trochlear nucleus. Okay. Now, from this trochlear nucleus, what is happening? The trochlear nerve is arising. This pink nerve is called as trochlear nerve. But if you can observe here clearly, right? The trochlear nucleus on the right side, the trochlear nerve on the right side, which is emerging from the right nucleus, is going on to the left, and the left is going on to the right. So there is what? There is a decussation. Okay. Next important thing, this is called as your substantia nigra. This is called as your substantia nigra. Okay. Now, what is happening over here is that this particular nucleus is called trochlear nucleus. From the trochlear nucleus, you see the trochlear nerve that is going on to the opposite side. After going on to the opposite side, it is passing in between two arteries. One is called as a posterior cerebral artery, another one is called as a superior cerebellar artery. Okay, so one is called as your posterior cerebral artery. Let us say this is your posterior cerebral artery and this is your superior cerebellar artery. So this nerve is passing in between posterior cerebral and superior cerebellar artery, and then it is passing along the lateral wall of cavernous sinus. For example, if this particular structure which I have drawn over here is your cavernous sinus, right? So this shading whatever I am giving here right now is called as a lateral wall of cavernous sinus. So this is your cavernous sinus. So can I tell that above this nerve there is third pair of cranial nerve and below this there is second pair of cranial nerve also passing through the lateral wall of cavernous sinus? So they are passing along the lateral wall of cavernous sinus. After passing through this lateral wall of cavernous sinus, it will enter into a fissure called as supraorbital fissure. Supraorbital fissure. Once it comes out of the supraorbital fissure, it supplies only one muscle over here. What is this muscle? See, there are two muscles actually here. What are these two muscles? See, this muscle over here is called as levator palpebra superioris. Levator palpebra superioris, and this muscle over here is called as your superior oblique muscle. Superior oblique muscle. So it looks as if it is supplying the levator palpebra superioris. No. So it is coming down, right? It is coming down and it is going above from the mid part of levator palpebra superioris. Okay, it is taking a U-turn from the middle part of levator palpebra superioris and it is supplying the superior oblique muscle, right? But for instance, you also have to remember this. Remember this formula like SO4, LR6 and R3. What do you mean by SO4, LR6 and R3? SO4 in the sense your superior oblique muscle. All these are the extraocular muscles, right? So superior oblique is supplied by the fourth pair of cranial nerve. Next, lateral rectus is supplied by the sixth pair of cranial nerve, and the rest of the muscles, rest of all the ocular muscles, extraocular muscles are supplied by the third pair of cranial nerve. So our topic is fourth pair of cranial nerve. That is what? That is your superior oblique. So it is giving only one innervation to your superior oblique. Okay. So this is all you need to know regarding the fourth pair of cranial nerve, guys. So thank you so much for watching my video. Goodbye.